Hello, everyone. My name is Natalia Saukova, and I'm International Scientific Officer of IADS. I'm really happy and excited to welcome Dr. Arthur Partian, who's going to talk about interdisciplinary treatment planning before and after diagnosis. Welcome, Doctor.
Hello, everybody. Thank you, Natalia. I hope you are hearing me well. I don't know how many people are listening to me, from which countries, but I'm very glad that I'm doing a webinar for you guys, International Association of Dental Students. I was very glad that I gave this presentation in your mid-year meeting in Beirut that was held in February this year. So your scientific person, Natalia, wanted to share this presentation again on a webinar with you. So as you see, this is a photo from Beirut, and I will start my presentation now. If I can ask you, what is this? Can you answer me? If there's anyone who can talk or while I'm doing presentation. Anyway, so this is a way of transportation, right? This is a big yacht. And this is another way of transportation, a jet. So this is another way of transportation too, as some believe or practice. So it doesn't matter what kind of transportation or what kind of technique you are using to go from point A to B, but the most important thing is to keep the balance in your work or way of doing things. Because nowadays we have too many things, too many techniques, too many instruments, too much technology in our industry. So how we will be able to keep the balance between all these instruments, machines, techniques, everybody is coming up, 3D scanning, 3D X-ray, etc., etc. So the main purpose is to know how to do the practice by keeping the balance of the work. So you can be the best dentist, but if you don't know how to plan and present the plan to the patients, you might not have the opportunity to treat them, right? So the way of presentation is very much important. How you present your treatment plan to the patient. So here I show this to the audience most of the time, and I ask them what do they see. So some they say they see an implant surface, and some others they say this is I don't know, rock. Somebody told me this is fiber post. Anyway, so this is the local supercluster. This is the Virgo supercluster, which is part of the observable universe. So this Virgo supercluster that we are in is a dot in the local superclusters. And in local supercluster, Virgo supercluster is a point, as you see. And in the Virgo supercluster, we have the local galactic group. Why we call it the local galactic group, which is another dot? Because our galaxy, Milky Way galaxy, is inside it. And the Milky Way galaxy has the solar interstellar neighborhood, And in the solar interstellar neighborhood, we have our solar system. And in our solar system, we have different planets, 9, 10, 11, maybe. And here we are on Earth. Here I'm trying to show you that we are in a big space. And from this big space, I come from this area, which is the Middle East. Originally, I'm Armenian. I'm born in Turkey, Istanbul, and I live in Lebanon. So my name is Arthur Araypartian. I graduated from Beirut Arab University. I have master's in prosthodontics, and I have a specialty in implantology. I'm instructor in prosthodontics, and I give photography courses for postgraduate students. I am a Minek Knight. Minek Knight, that is, I am in the Megagen. Megagen is an implant company in Korea. Megagen International Network for Education and Clinical Research. We do clinical research as well as other research studies all over the world together with other dentists, and we give lectures and courses related to implantology. So, part of my activities in dentistry, I do full mouth rehabilitations, and I give courses for the dentists and for small groups. They come to my clinic. I give lectures and courses in implants in the aesthetic zone. My research was on zirconia. I did a framework design. It was published in an international journal back in 2008. And I give lectures on zirconia, as well as this is a zirconia-based full mouth, full arch on implants. I give also courses in anterior indirect veneers. Of course, here I want to thank my mentor, Dr. Galit Gulal from Istanbul, who supports me a lot while doing my courses in aesthetic veneers. We give basic and intermediate courses in veneers too. Maybe some of you want to join us in the future. So today's lecture will be interdisciplinary treatment planning. So this thing is very much important because you don't have this subject or this course in your faculty. And it's always misunderstood, misused, and abused sometimes, our treatment modalities. So let's talk about the companies. Why do companies plan? Because they want to orient their goal, okay? So they have goals. They have to organize their work. They have to establish budget. They have to be efficient in their operations. And the results, the product, must be consistent in quality, so they have to be predictable. And as well as they try to reduce their cost, of course, to maximize their profit, but not on the expense of the quality. So why dentists don't plan? Because as you see the figure, too many things, too many procedures learned in the faculty to execute them. And we have difficulty in managing all this information because we don't have a management course related to the subjects overall as treatment planning course. Lack of discipline to take rational decisions because every specialty, they want to emphasize on their part what should be done. We need to give time in order to do planning. But if we learn it, it's very easy. Unpredictable results because we don't go from A to B, C to D in an organized way. So we don't have predictable results most of the time because we don't do good planning. And most of the time, dentists are focused on money. So how much money they will get out of this procedure or work. So I put this small video from Pink Floyd's The Wall movie, where here I want to show you that in the faculty, we are like in a wall, okay? So our professors, they teach us our techniques, and we consider ourselves that we know everything, and we build around us wall. But it's not like this. We have to break this wall and go beyond what we learned in our faculties, because there are too many things outside the faculty. Some are evidence-based, and some are very new techniques that must be practiced in order to know if they work or not. So we will do here a little brainstorming. So we have 3 doors to pass through, okay? The first one is the clinical examination. So to fulfill the aesthetic outcome, finally, we have to do good clinical examination, which is one of the most important tasks. If we don't do good examination, if we do it haphazardly and we don't focus on it, we won't be able to do good treatment planning. And if we don't do good treatment planning, we won't be able to present this thing to the patients. And if we present it to the patients, we won't be able to execute it. So in dentistry, we have to use our left brain, which is the scientific, analytical, logical, rational, objective. All are related to the rules and regulations and theories that we learn. And as well as we have to use our right brain, which is artistic, creative, intuitive, subjective, general, conceptual. We combine the right and the left brain to have somehow, relatively speaking, perfect treatment that will suit best for the patient. So we have simple cases encountered in our clinics. We have very sophisticated cases, cases that were not very well planned, and cases that were abused or overdone. So this case is relatively a simple case, where the patient wants to have only on her 6 anteriors veneers. On the other hand, this case is a bit difficult case, where we have almost full destruction of the posteriors, and we have to rehabilitate all the dentition. And this case, which was presented to me like this. So when I asked the patient, I saw her first time, I told her what we will do after the braces. She said, I don't know. So this was incomplete treatment. I like this Pisa tower because it helps me a lot to bring my message to the audience. Leaning Tower of Pisa. Why it's leaning? Because the examination of the ground was not done well. Because at that time in Pisa, the rulers were so proud of themselves because they were the strongest back then, and they had a lot of money. So they were too much taken by their power and their richness, and they wanted to have this tower to show the neighborhood that they are very strong. But they were fooled by these because they didn't do good inspection of the ground. So the examination was not done well. So they had the Leaning Tower of Pisa. Fortunately, this tower is now for them. is an iconic tower and all the tourists go there. But I don't think that when you have leaning smile on your patient's face, it won't be an iconic smile. So, how to do all this? First, we have to do comprehensive examination. We have to do personal analysis for the patient. Preclinical interview. We have to find out what are the preferences of this patient. What does she want? What does she need? What are her wishes? How she wants to be treated and how she wants to look like when we end up. And her expectations. Expectations are dangerous. We can listen to their preferences, needs, and wishes, but we can listen to their expectations too. But we have to control it, because some of the cases we cannot have them as they are expecting to have. So first we do clinical analysis. We take X-rays, we take photos, we take videos in order to see how the lips are moving, how the patient is reacting, how she is smiling. And then we put it on PowerPoint or keynote presentation, and we do the DSD analysis. So DSD analysis is now a very well-known digital smile design. I will talk about it. So digital documentation, photography, which is one of the most important things now. From my experience, and I have a friend who will now publish a book about digital documentation in dentistry. The DSLR is the best equipment now, machine, to take photos of a patient, because it gives one-to-one without distortion the images that can be replicated and can be superimposed on other scans or X-rays that are now we are using. So pre-op aesthetic evaluation in motion, as I told you, to see the movement of the muscles, the lips, the extent of the smile, patient communication, team communication. These photos and videos are sent to our colleagues as dental technicians or other specialists. Phonetics, we see how the patients are talking, function, and patient's emotion. Other than the digital photography, we do digital documentation with an intraoral scanner. This is very much important nowadays, especially if you are working with technicians who don't live in your country. For example, I have a few cases. I sent them to Brazil, Italy, or Dubai. In the past, I used to take the impression and send them via courier services, DHL or UPS. But now it's becoming very easy for us to take the digital intraoral scan and send the file to the patient, to the technician. So data collection is very, very much important. Data not gathered and organized cannot be treated. So we have to gather and organize the data in order to know how to treat. So we have the patient, implants, lab technology, prosto, minimally invasive, perio, the ceramist, material selection, ortho, planning, financial situation, morphopsychology. I don't know if you have idea about morphopsychology. It's related to the morphology of the teeth, related to the psychology of the patient. This we talk about it in our aesthetic courses or in our aesthetic lectures. So we have to find the link between all these. So the patient comes first, and we choose which specialty will be executed according to the plan. So on the first visit, first appointment, the patient comes, we take impressions, and we have the models or the soft model, which is taken by the intraoral scanner. And then we take the photos and then put it on a presentation. And all these, with the presentation and the models, here I want to talk about the DS, Digital Smile Design. You know, of course, Kochman. I think he was with you. He gave a webinar too for International Association of Dental Students with Calamita and Scheider, who are, Scheider is a dental technician and Calamita is a prosthodontist, is a big professor. They developed together the digital smile design. First, we needed only a digital DSLR, Keynote or PowerPoint, and the computer. Now we are using 3D scanners, intraoral. We are using CBCTs and extraoral scanners too. So after taking all these data, we sent by Dropbox or other ways to the technician and to the specialists. We send them with the comments, of course, in order for them to know where are we heading to. After taking these into consideration, the technician sent us the wax up, either the 3D model or the soft model, and we print it later. And the specialists, they send us their feedback on the presentation. If the case is easy, we directly present the plan to the patient. And if we need, we do a mock-up for the patient in their second appointment. In this way, we will be able to show to the patient where are we going, what will be the final result. If not 100%, trust me, 98%, we can reach to the plan or to the mock-up or to the wax-up or to the treatment plan that we have already agreed upon, together with the patient, because we have the patient, us, the dentist, and the specialist, and the technician. These three, if they are synchronized and they have their goal is one, it will be very easy to execute the plan. So what are we going to do after the clinical examination? We will present before presenting, we will do the treatment planning, sorry. So treatment planning, science, but not exact science, because there are too many factors in it. So in order to be able to do treatment planning, I hope if you have questions, you are taking notes for you to ask me after the presentation. Anyway, so in order to do a treatment planning, we have to have, of course, our formal education. In the faculty and later, clinical experience will help us a lot. Continuing education, very much important, outside the faculty, with other dentists, with other specialties, preferably references, but not commercial references. Unfortunately, nowadays in social media, you have too many dentists. They are giving courses, lectures, but their lectures and courses are mostly show-off things. They don't teach us the right way to execute things. Anyway, I will talk about this point later. Books and journals reading, which is very much important, and exchange of information with experienced and honest dentists. Is this enough? For us, this is not enough. We need other things in order to do good or excellent treatment planning. We need mentors. Mentors are very much important too, because they guide us in a proper way. Of course, if you are lucky, we have good mentors. One of my mentors, Dr. Galip Pirello, as I showed to you, for me, he's an excellent mentor, because the mentor must not be only talking about articles or research. They must, if you can, see, they must be able to apply all these in their clinical practice. Because with my experience, I'm seeing there are dentists who are talking very well about literature, but practically they are not applying it, or they are not being able to apply. So we need mentors who are applying things and they are teaching us the same. That is the ideal way. Partnership with technicians. This is, again, very, very much important, because if your technician is not synchronized with you, you won't be able to work well. For example, if you are working in a digital environment, using digital photography, scans, etc., and you send to him by email or Dropbox, if he doesn't use the computer, he will not have good results. I'm telling you this because I had this experience before. So you have to be in synchro with your technician too. Time. You have to dedicate time in order to do a good treatment planning. You have to consider all the alternative treatments. Then common sense. Common sense is relative, but I will not focus on that. And self-critic, but I will focus on self-critic, because no matter how people they criticize you and how much they praise you, I think we are our best critics. We know if we did the thing good or not good. So I leave this in your hands. I wanted to show you here, to tell you about Professor Marcello Calamita, who is one of my mentors. And this presentation that I'm giving to you, the backbone is from his lecture. I had the honor to be giving with him in Zadar in Croatia lecture in 2015. If you see him in a seminar or conference, you will be amazed, because he has amazing way of delivering messages. He's an amazing prosthodontist. He's an amazing mentor, not commercial, of course. So I like to thank him again. And then I will go back to my presentation. Dazed and confused. Confused because we have too many materials, too many information, too many options, too many techniques. What are we going to do? Which step we are going to do before the other? At first, we had the multidisciplinary treatment planning, where each specialist was doing his best in his specialty, and then the result was not successful. Now we have interdisciplinary treatment planning, and interdisciplinary treatment, because before executing the work, the planning is being done, and not according to their knowledge and according to their talents. Each specialist is executing their work. So I want to show you here the designer's planning path. Actually, we dentists, we don't have this kind of planning path as in textbooks, but the designers, they learn these in their studies. So first, they define their work. They do research, they do analysis, they do their investigation about the certain topic. Then they do the design phase, which is the experimentation and exploration phase. They do the design, they do sketch, they come out with concepts, templates, they create prototypes, they build prototypes. And after experimenting, exploring all this, after doing, of course, the research, they present this thing to the client, okay? So we come up with testing prototype things, and they show to the client. And accordingly, they go to execution. So this is almost the way that we should follow in order to do our treatment planning. So the treatment planning must be evidence-based, of course. Clinicians and lab technicians' skills must be very good and in synchro. Patients' needs, wishes, and commitment. Needs and wishes are very emotional sometimes with the patients, but their commitment stays questionable. Because some patients, they are not committed and they want to have their needs or wishes done quickly. We have to explain to them that things might take time. So here are some references for you to note or to take in order to know how to do a good treatment planning. Cohen, Linde, Dawson, Coyce, Spear, Oil, Roble, Pankey. These are very important references. These are very successful doctors who have done these books for us to know how to do a good planning. Never start any procedure without visualizing the final result. If you are going to do ski, before going to the mountains, you take your gear with you, right? You don't just go up to the mountains and then decide that you will do skiing and you don't have your gears with you. Okay, you can buy there, but in dentistry, it doesn't work like this. You have to visualize your final result before starting your work. What do I mean visualizing the final result? I mean that you have to have the concept in your head. Here I wanted to show you this example of the Ferrari F80. So this is the concept car designed by Adriano Raele. So Adriano cannot come up with this concept design of Ferrari if he isn't sure of the material that is available, if he is not sure that his technicians will be able to execute this concept, if he is not aware or if he doesn't know that the Ferrari will not have the proper engine to support this car. So the concept comes out putting in mind that he knows all the steps that will be done and every technique that will be used in order to solidify his concept. So in order to this concept car to be solid, he has to know all the potentials of the materials and the technicians that he works with. And this I linked to a smile that I did, this smile. So I wasn't going to be able to do this smile if I didn't know that my technician, Adriano, will be able to do it for me. Only preparing the tooth for veneer or a crown is not enough. If your technician is not skilled and he doesn't have the enough material to do this kind of veneers or crowns to have the perfect surface luster, the characterization, translucency at the incisal edges, you won't be having a good smile. You will be having a toilet white smile, as it is now in most of the people's mouth. So let's go back to serious. First, we started our treatment planning taking into consideration biology and support. Biology as the hygiene, education of the patient, cleaning, And the support, I mean the posteriors, crowns, inlays, and onlays, these were very much important. They are still important, but they were priority back then. Then the function came. The position of the maxillary and mandibular arches in the centric relation, re-established plane of occlusion. And then we used to think about aesthetics, improve the incisal plane, color, and shape of the anterior teeth. But nowadays, it doesn't work like this. Nowadays, it's like aesthetics comes first, but we don't execute aesthetics. We take the aesthetic endpoint, which is determined, and we establish a logical sequence. So we will visualize the aesthetic endpoint, and we establish a logical sequence from biology, support, and the functional parameter taken into consideration, respecting biological limits and timing. So we don't neglect the biology, we respect the limits and some timing factors in the healing procedure, support of the posterior, and the functional parameters of the patient. So after doing the treatment planning, now we need to present the treatment planning to the patient. So I'm sure you heard the sound of the engine, but it went off. Why? Because in order for the engine to start, we need to have the key. If we have the key, the engine will start and it will continue. In order to start our treatment, we need to do good presentation to the patient. And presentation, it needs skill. So you need to present the case in an intelligent way for the patient to understand, not in a boring way, because the patients, they don't care about the manufacturing techniques of the materials that they are using, the ceramics, implants, or posts. They don't care about their molecular formula or how they were manufactured in the company. You don't need to mention all these things to the patients. On the contrary, we have to give them sequence of the work. We have to give them the list of the problems that they have. We have to explain them the condition their teeth they are in. Explain probable consequences if the treatment was not performed. What will happen? For example, sometimes we do a good treatment planning and we present to the patient and we tell them, if you don't do this now, after a few months or after 1 year, the treatment plan can be changed. Ask the patient if she is or he is interested to know how to be treated, because some of the patients, they are not interested. We don't need to tell them. We just execute the plan. For example, I had a patient to whom I did a work almost above 15K euros, and he was not interested what I am doing. He just wanted to have good smile and he wanted to eat well. So if they want to know, we present the treatment options according to the priorities, explain the concerns, limitations, compromises, risks, and costs for the different options. And then we elaborate the treatment plan considering the patient's preferences. Sometimes the preferences can be altered. We have to explain to the patient which must be prioritized, which treatment must be done better. We have to educate them because they just come. Some of them, they do their research, and some others, they don't come. They come just naked to the clinic, and they don't know what are the techniques, what are the ways. So we have to educate them. And everything that is explained before the procedure is education. Everything that is explained after sounds like excuses. So before doing anything, we have to explain to them every detail in the procedure. Because if we are trying to clean the cavity and we know that we might need root canal treatment, we have to tell the patient before starting. Because if we tell them we will just do cavity cleaning to do a restoration, simple restoration, and then we open the cavity and we find out that we have root canal exposure, they will think that we did something wrong, and it will sound like excuse. Plus, we have to tell them that the treatment will never be so simple, conservative, and more economical if it is not performed now. Once I had the patient, I gave him the treatment plan, and he disappeared. He came back after 3 years, and I told them that we will change the plan, and it will cost, for example, few hundred or few thousands more. He was complaining because before 3 years, the treatment was different. So we have to tell them that it will not be the same if you won't do it now. So here I will go through some frequently asked questions from the dentists and from the patients. So the patients, they want to know, how long does this treatment take? So in order to tell them how long it will take, so we have to show them their preferences and our advice to them which things must be done first. Second, their biological limits, because some things can't be executed directly. We have to wait. For example, in the past, we used to extract the tooth and wait a bit and then put an implant. Nowadays, it's relatively easier to do this, but some cases, we cannot do it. We just need to extract the tooth, we have to wait and then do bone reconstruction and then do the implant. We cannot promise the patients that we will do these all in one session. We might need several sessions to execute a certain procedure. Patient's financial condition. Our materials are very expensive. If you are going to work with master technicians, skilled technicians, they are expensive too. So we have to check their financial condition and accordingly decide how long it will take. It depends on the risks. We have to assess the risks in aesthetics, in function, in support, and biology. And how much there is commitment from the patient side and cooperation. It's very much important. How long it will survive. This is a very important point for them to know. If we use this kind of material, it will last this much. If we use the other one, it will last this much. And here we can show them references. We can show them articles. We can show them graphs, figures of the survival rates of the veneers, if they want veneers. Emax material, if we will use Emax. Inlays, onlays, how much they will survive. Tooth implant, how much we have success rates. So our services, skills and judgment capacity is very much important. State-of-the-art equipments. We must not just bring state-of-the-art equipments in our clinics. We must be trained on them. We are not showing off that we can buy. We have to be able to use these instruments, but not overuse it. We have to know where to use the laser and where to use the blade. We have to know where to use the scanner and where to use the impression, where to use the Facebook, where to use the microscope, where to use the loops. Not every case we use the microscope, and not every case we can use laser, and not every case we can put bone graft. So the materials that will be chosen, they must be the best. Here the best is, again, relative. It depends on the references. For example, some dentists, they want to use human bone as an autogenous graft. Some others, they want to use xenografts. So this depends on their experience and their reference. Personalized work. We must tell the patients that this work is personalized for him. We cannot execute this work with the sequence that we are talking to another patient, because the other patients might need other ways of treatment, other materials, other techniques, etc., etc. How much it will cost? One of the crucial points. They want high quality, so normally the value will be high. Sorry. So the price will be high. But unfortunately, the patients want high quality with low price. And the dentists, unfortunately, they are taking high price and they are giving low quality. So we have to focus on quality without compromising, and we have to have our good price list. So if the patient is going to a newly started novice dentist, it might be different than he is going to an average dentist or a skilled dentist or a specialist. If they are coming to an expert, they must know that they are coming to an expert who is very well equipped and talented and skilled, and he knows what he's doing. The microscopes. I wanted to show you this microscope because nowadays it's the in product other than the digital scanners. Sometimes it's abused, but most of the time it's very, very, very successful. And it's very helpful to use the microscope in some operations, in root canal treatment, and in veneer preparations in order to adjust the finish line very well. But here I have to mention that if you are using a microscope, you have to make sure that your technician is using microscope too, and he's not using conventional way of preparing the core or the framework. So he has to use a microscope in order to adjust his finish line accurately. The skills and judgment capacity, it's very much important how much we are going into the treatment. Do we need this much of treatment, or it is over treatment? We have to know our limits. We have to know how far we will go with the things that we know or the things that we are skilled in. Customized work. Each patient, as I mentioned before, must have his plan or her plan of work. How to perform effectively the plan. Team's clinical skills. As I told you before, there are too many professors who know literature very well, but how much skillful they are in the clinics, this is very much important. It's not important for the patient to know that you know all these things. After all, he wants the perfect smile or the perfect occlusion in order to function well. If you're not being able to apply your knowledge, it's useless for them. Communication and documentation is very much important. Communication with the technician and the specialists, and documentation of the case before the beginning, during the work, after the work, and after the work for the follow-up. After 6 months, maybe 3 months, 6 months, 9 months, 1 year, 2 years. Continuous re-evaluation. We have to evaluate our work, re-evaluate. Every now and then, we have to call back the patient and we have to re-evaluate our work, because sometimes it's uncontrollable. So we have to make sure that the treatment is under control. Here you can see the teeth. These are 2 veneers. First, I showed you only the smile, but for me, the ceramic is not that much important than the biology that I'm showing now to you. This is after 5 years follow-up. You see the finish line at the laterals. They are perfect, as well as the others, but I'm emphasizing on the laterals. This is the result that we want, and this result can't be achieved if we didn't do good preparation, good impression, but it's not enough. We have to have an excellent technician who can bring the veneer exactly to fit the margins of our preparations. Precision, how precise we are in our technique. Every technique can include an error. So as much as we eliminate the errors, we exclude the errors, as much as we have chance to have 100% precise work. Patient's motivation and compliance. It is very much important for the patient to be motivated, because some procedures, some treatments, some cases, they need more than few months of treatment. They might need few years. For example, I had too many patients with whom I worked more than 3 years to start with the surgery or the ortho, then wait for the orthodontics, then come back, do perios procedures or second stage implant things, and then continuing the work, stabilizing the occlusion, etc., etc., etc. Maintenance protocols based on individual risk assessment. If we have a single crown, it's not too much risky. So the maintenance of a single crown is not too much difficult comparing with the full mouth rehabilitation. If we have 8 implants on the upper maxilla with ceramic framework on top, or hybrid restoration on top, and lower we have full arch ceramic on natural teeth, some vital and some non-vital, some veneers. So as much as the work gets complicated, as much as the maintenance protocol must be changed, and the individual risk assessment will be different. Why did I put the fighter jets photo here? Because the maintenance protocol for a simple car, road car, sedan car, or whatever car, is relatively much more less than this fighter jet. And the risk assessment of this fighter jet is too far from a normal car. Rigorous evaluations and fine adjustments at every recall, because we might need to do some adjustments at the recalls, because our mouth, our occlusion, it's always in motion. It's always changing. It's not like that 21 years old and it's finished, or 23 years old and it's finished. Always, always, and always through the years, our dentition, our occlusion is changing as our body. The bone is adjusting itself, the dentitions are adjusting itself, the muscles are adjusting themselves. So we have to do rigorous evaluations of the work that we have done, and we have to define adjustments. Because if we don't define adjustments, we will need crucial adjustments to do. And this might take time if we don't do the adjustments at every recall. At every recall, I mean 6 months or 1 year. If the patient disappears for 4 years and comes back, too many things might be changing in their mouth or in their occlusion. So we have to make them aware that they have to come to visit us every 6 months or 1 year. Proper documentation. As I told you, before starting, during the treatment, and after the work. Because if we don't do proper documentation, after a few years, they might come to us and they can tell us that this was the way that we did. But if we have proper documentation in our system, we will be able to show them the sequence that we followed and the things and the steps that we have done. Again, here, I want to tell you again, everything that is explained before is education, and everything that is explained after sounds like excuse. Don't forget this sentence. And thank you very much for listening to my presentation. I hope, if you want, other times if you need me to give other presentations, as I mentioned, just inform, and I will be very glad to share my presentations with you. Thank you very much again.
Thank you. You're more than welcome to ask any kind of question. You can send it either through email to iso@ids/web.org or directly through YouTube. I would like to thank you so much. Even though I already heard this lecture, even for the second time, I really learned a lot, and I especially love the way that the metaphors that you use, so it is easily understandable, and I know that I will remember it forever now. So if there are any kind of questions, Doctor is still here.
Yes.
I wanted to ask you personally, while we're waiting for some questions, what about some patients treatment planning and explaining and presenting to patients with either disabilities or with with a higher age, or with some disabilities? Of course that the presenting must be much simpler, but have you had this opportunity? Do you have any recommendations?
Excuse me, I couldn't hear your voice well. Do you mean for patients who have disabilities?
Yes, any kind of disabilities. That when you're explaining the treatment plan and presenting them, do you have any recommendations?
Of course, if they have disabilities, we have to be precise in the techniques that we are using, and we must not exaggerate to them the treatment. We go directly to the needed procedures that must be done. But again, I'm not so sure what do you mean? What did you mean by disabilities? They're physical disabilities you meant, or mental disabilities?
Well, I was thinking mostly about mental, and with elderly patients, because
Okay.
actually this was my case last week, that I had a really old lady, but she was really nice though, but you know, really hard to work with.
Okay.
And you know, whether this should be, of course, that is more problematic and much simpler need, we should speak much simpler way, but is there any specific technique that you use or any trick?
Most of the time, with patients who have mental disabilities or they are old patients, I mostly advise their children to come with them and to
Mm-hmm.
explain the procedures when they are present. And sometimes, why not all the time, to be available while we are doing the procedure or while we are working. Because sometimes I have patients who forget what we did and who forget what we are doing. So I want their relatives or their children to come and stay with them. And especially if you are taking decision of what kind of procedure we will do. For example, before 2 months, I had a patient from Boston. I did to her, she's 80 years old, and I did to her 5 implants. Her son is relatively a medical doctor, and she was a compromised, health-wise compromised patient. So he was coming with her all the time, and we were taking decisions together. And especially, she needed to have few medications. So, and she was forgetting. So always someone from her family or someone she relies on or takes care of her or him must be with them in order to be able to follow up with them everything that we are doing. And we can try to be as much as possible fast with the procedures that we are doing, of course relying on our skills and on our experience. Not that we have to do fast but not complete work. We have to be fast but accurate.
Okay, thank you, thank you. Yeah, that's a, I mean, it's a simple but still very important thing to do, because yeah, the lady came, well, she was hospitalized, so they brought her basically, but without any relatives, and it was really hard to communicate with. So yeah, definitely that would be the best, that would be the best solution in that case. Thank you. I'm still I'm still looking for some questions, but we have not received any. So I would like to thank you a lot for today,
You're
and
most my pleasure.
hopefully next time we'll have another great webinar with you. And I wish you good luck and
Thank you.
continuation, and a great sunny day in Beirut.
Thank you very much. Enjoy.